Are scars from cosmetic surgery holding you back from getting rid of unwanted excess skin? Join me as we explore techniques that I have been using throughout the years. I will show you how we're able to reposition your anatomy to its youthful glow. The most important thing is to consider the anatomy. If you look at the skin and the tissues underneath the skin, there's a dermal plexus between the skin and the muscle. Whenever a person undoes the skin, they disrupt that vasculature, and then you have skin being stretched and tightened without its natural blood flow attached to the fatty layer. That's the reason sometimes people look stretched instead of plump and lush and have that natural glow. I like to use the analogy of a bed. If you think of your bed in different layers, from your sheet and your blanket all the way down, there are certain layers where if you do something in one layer, it will affect another layer. So in the face, there's what we call a superficial layer and a deeper layer. And you've probably heard the term SMAS or superficial or skin lift, and you've heard about deep plane lift. Well, the deep plane is actually right under the superficial layer. It's in the middle of the face. The deepest plane is down to the bony area, and that's like working on the bed from its foundation all the way up to the sheet. So if you want to recondition, restructure the entire bed, you want to start with a level bed frame and a level box spring, and then build up from there, just like the layers on a bed. So the main question everybody wants to know is, how can you recontour, change the skin without removing excess skin? I call it the Tic Tac Toe rule. If we drew out a Tic Tac Toe and we had 9 blocks and you went across diagonal, corner, middle, corner, that would be like a side view of somebody having an obtuse neck with some extra skin. If you tighten the deep layer, but we don't affect the skin and the fatty cushion, then it goes straight across, like on a tic-tac-toe, that's 3 blocks, and then it goes down 2 more blocks. So you have a surface area of 5 blocks to recontour the skin versus 3 blocks if you have all this heaviness and fullness in the neck that's pushing it and giving it that excess look. So the thing to know is, it takes more skin to redrape into a normal position than when it's out of position. And so if you think about it, you didn't just start growing skin all of a sudden. What happened is your deep layers changed, gravity pulled it down, and it made it look excess because it's not tucked up into a corner anymore like it used to be, like a tic-tac-toe across and down. If you look at this example here, you see that postoperatively, the neck can either look skeletonized, where somebody took out too much fat between that layer of skin down to muscle, or here you see in this picture where a person has an elegant, plush looking neck postoperatively because the upper layer of fat was not removed. I never remove any of the upper layer of fat. I keep the skin and the fat and the muscle together as one unit. And the only fat that's changed is below the platysma and the deep glands. That's the difference between having a postoperative, plush, elegant neck versus a skeletonized, surgical looking neck that has bands. And that also requires a scar, whereas the other one is working on the deep structures with no scar. So in summary, it's the hammer and the nail concept. If you're, say, a dermatologist and you work on the skin and you have some lasers, well, that's all you have to offer. If you're a typical surgeon, a plastic surgeon, a facial plastic, and you're doing things that people did 20 years ago when you were taught, you're taking the skin down, you're looking under the skin, you're going through the fatty tissue, you're going down, it's either superficial or deep, but no matter how you do it, you're making a large incision. People make an average of a 70 centimeter scar along your face. You can look at people's pictures and see a scar go all the way along the hairline and shorten the temple into the ear, behind the ear and back into the hair. That's pretty hard to hide. And it takes your thicker cheek skin and it moves it onto your ear. So even if the scar is not very visible, your ear still looks distorted because this pretragal area, this is called the tragus, this little bit in the middle, this whole pretragus area has scar and discoloration. The other thing that you see frequently is people have these little spider vessels around their ear. And the reason they have that is because it causes ischemia. It's pulled too tight, so little capillaries and little vessels are trying to form and sprout. So you see these little spidery vessels after their surgery that they didn't have before their surgery, because before their surgery, their blood vessels and their blood flow was not compromised. So if you can offer all these different things to people and you're not stuck with a hammer and a nail, then you can do what's best for a person and customize it whatever they want. But one thing that I always do is I treat everybody like they're allergic to pain and like they're allergic to scars. So I believe and I practice that you can have facial aesthetic surgery without a scar.